Senator Kamala Harris has unveiled her vision for healthcare in America, and she put out some details for her proposal. Now, as we know, she's been very wishy-washy when it comes to her support for Medicare for All. She still claims to support Medicare for All, but it appears that she wants to create a system in which private insurance is still very much necessary. So let me give you the details. Kamala's plan has a 10-year phase-in versus Bernie Sanders' 4-year phase-in for Medicare for All. She also has this role for private insurance, which we'll get to in just a second. And she claims that she would not add any taxes to the middle class and only focus on raising taxes for individuals making $100,000 or more. Now, according to the New York Times, instead of completely replacing private coverage with a government-run single-payer system based on traditional Medicare, Harris would allow people to choose plans modeled on Medicare Advantage, which would be run not by the government, but by private insurers. So, okay, let's just focus on that part for a second because I think that's important. So the idea is, for Medicare Advantage is where it's at because Medicare as it stands today doesn't cover everything. So you have to supplement Medicare with private insurance, which I think is a really bad idea because it still creates a system in which Medicare can be gutted and then the need for private insurance continues to increase, right? The dependency on private insurance continues to increase. What would Medicare cover and what would private insurers cover? I mean, you really have to get into those details. And I just think that this creates a system that makes Medicare extremely vulnerable to corporate interests.
Okay, let me add to that. So first of all, there's a misnomer about Bernie Sanders, Medicare for All, and Pramila Jayapal's in the House, et cetera. So when and I think Bernie accidentally partly leads into this when he keeps talking about cosmetic surgery. The reality is that you would have private insurance under all those plans, including Medicare for All, for anything not covered by Medicare. Now, the reason Bernie keeps saying cosmetic surgery is because almost everything would be covered under the new Medicare.
Yep.
And so that's why the things left uncovered is things like cosmetic surgery. But if there's something uncovered that you really need help with, yeah, of course you can get private insurance for that, as long as it's not covered by Medicare. So then you ask the next logical question, which a lot of good, well-intentioned people ask. But wait a minute, what's the harm in private insurance also being around? Well, what private insurance is gonna do is set their rates low. Well, that sounds good, right? Well, how are they gonna set them low? By doing two things. One, by covering only the healthiest Americans. And then they're gonna unload their costs for the sickest Americans to the American taxpayer under Medicare. And then they're gonna pretend that they are the better option. But if the sick try to join private insurance, they'll say no. They'll set up conditions where they don't want the sick, whether they kick them out later, and that's problem number two. Even if you were allowed into that insurance in the first place, they could go back to the old days. They say, look, you got Medicare as an option, so I can set any rules I like. Now my new rules are, hey, if you hit a cap, I'm gonna kick you out. Don't worry, Medicare will pick up the rest anyway, right? So that way, they have very little costs, and they blame the government for everything. That is not how an insurance pool works. You need everyone in the same pool, otherwise it's not real insurance. And it's a trick meant to put all the money on the American taxpayer, put all the costs on there, and keep all the gains.
Exactly, yes. So let me give you some statements from Kamala Harris, and she wrote about the details of her policy in a Medium post. Medicare works, she says. Now let's expand it to all Americans and give everyone access to comprehensive health care. So that's one portion of what she writes. So she understands that Medicare for All is a popular proposal, which is why she's so wishy-washy, because she wants to stick to the private insurers, but she wants to capitalize or exploit, capitalize off of or exploit the popularity of the Medicare for All program. So she claims she's supportive of Medicare for All, but then you get into the details and it's clear that she's not. The Medium post also says, quote, essentially, we would allow private insurance to offer a plan in the Medicare system, but they will be subject to strict requirements to ensure it lowers costs and expands services. If they want to play by our rules, they can be in the system. If not, they have to get out. What does that mean though? So how do you ensure that they're gonna play by the rules? We already know that corporate corruption influences a lot of the decisions that lawmakers make. So who gets to write the rules? How do the rules get written in the first place? And how do we prevent those rules from being essentially violated by the very corporate interests that have gutted health insurance in the country.
Look, I appreciate that she came out with a plan because before she was playing games. So whenever anybody was watching the debates and say, "Are you for Medicare for all?" she'd raise her hand and she'd say, "Yes, absolutely."
Yeah, we actually have video of that. We have a quick video compilation that shows all of the wishy-washiness of this whole healthcare issue for Kamala Harris.
I believe it will totally eliminate private insurance. So for people out there who like their insurance, they don't get to keep it?
Well, listen, the idea is that everyone gets access to medical care. And you don't have to go through the process of going through an insurance company, having them give you approval, going through the paperwork, all of the delay that may require. Let's eliminate all of that. Let's move on.
Well, we were together.
Yes.
And you'll remember and roll the tape, please.
Yeah, we can roll the tape. Well, you support the Bernie Sanders bill, which essentially gets rid of insurance.
I support Medicare for all, but I really do need to clear up what happened on that stage.
Okay.
It was in the context of saying, let's get rid of all the bureaucracy. Let's get all of the ways.
Oh, not the insurance companies.
No, that's not what I meant.
Who here would abolish their private health insurance in favor of a government-run plan? All right.
Do you believe that private insurance should be eliminated in this country?
No.
You don't?
No, I do not.
But you raised your hand last night.
But the question was, would you give up your private insurance?
She's been playing games.
No,
she's been playing games. Like, come on.
No. Look, so this is why the media loves her. Because they think it's a crafty politician, a smart politician, tricks the voters into getting their votes, but doesn't actually intend to do any of that. And the New York Times, true to form, found experts to call her plan, quote, more realistic, more pragmatic, and I love this one. They themselves wrote that this could, quote, go a long way toward neutralizing fierce opposition from insurance companies. What a joke. No, here's how it works. I guess the good folks at the New York Times don't know much about politics. Yeah, so I'll be obnoxious and educate you. Look, if you wrote informative articles, I wouldn't have to do this. See, what it does, what those big forces do is they apply a lot of pressure, including to your editors and publishers, and they buy a lot of advertisements, by the way, in your paper and all across cable news. And they say, "Oh, no. And I have all these experts that I funded in think tanks, etc." And the pragmatic approach is to, even before you start negotiating, give me most of what I want. And then after you keep the private insurance in place, then once I've gotten rid of Bernie Sanders and Elizabeth Warren, and I don't have those people threatening me on a larger scale, then I'll go to war against Kamala Harris's plan if she happens to win. Now, I'll support Republicans to try to make sure that Kamala Harris doesn't win. But then if she goes to do this middle approach, you think that the insurance companies are gonna be like, "Oh, you know what? It's a middle ground approach. No, we're totally fine with it." No, they will spend billions of dollars fighting it. Really, you don't know that at the New York Times? That didn't occur to you? You didn't notice that happen under the Affordable Care Act? You didn't notice any of what has been happening in politics over the last 40 years? You believe the mindset that if you give Republicans or private corporations half of what they want, that they'll be satisfied? That they won't want more? Oh, come on. That is dangerously naive. And so, of course, but the reason I tell you that, not just to take on the mainstream media, but we have to, because they do, honestly, a quite terrible job of covering politics. They do wonderful investigative reporting from time to time, but when they cover politics, they have such a deep bias in favor of the status quo that they're blinded by their bias. Anyway, the second reason I tell you that is because, to explain the trick, Kamala Harris has been raising her hand and saying she's for Medicare for all because she knows how popular it is. Isn't that interesting? So why not go all the way if you know that it's in fact 7 out of 10 Americans and a greater percentage of Democrats in the primary want Medicare for all? So why aren't you in favor of actual Medicare for all? Because the media doesn't like it and the donors don't like it. So you have to go to the donors and the media and go, don't worry, I'm gonna keep the status quo. I was lying up there to get votes. Of course I'm gonna keep the status quo. Now that leads me to my last criticism here. So I'm glad she actually put forward a plan instead of going Medicare for all, against Medicare for all, right? Now, the plan has a 10-year transition. Okay, that's not a plan. That means it doesn't exist. In the 10 years, the Republicans will sue. They will vote against it 100 times until they finally get a majority in the House or the Senate or both, and then they could get a Republican president. if Obama's transition period for the Affordable Care Act was way too long, and the Republicans used it to knock down the mandate, they used it to knock down the individual states, expanding Medicaid, they used it to batter the Affordable Care Act, and that was a 4-year transition period. If it had a 10-year transition period, well, Trump would have gotten into office and it would have never been implemented.
100%. 100%.
So a 10-year transition plan means I'm not actually gonna do it. Okay, well, at least you made it clear.
I mean, exactly. I love that you brought that up. I mean, it's like the equivalent of me saying, you know what, Cenk? 25 years from now, I am gonna take on all of your responsibilities so you can have more free time. That means I'm not gonna do it.
That's right. So, look, the mainstream media will continue to support establishment candidates like Kamala Harris while pretending they don't support anyone. They'll say, what do you mean? We're objective. But Kamala Harris's plan is wonderfully pragmatic and realistic and excellent. And goddamn Bernie Sanders, what bias? What bias, right? But here we tell you the reality. So look, if you're against Medicare for all, there are plenty of voters who are against that. Not really, but some. Then you should vote for Kamala Harris or someone else who's opposed to Medicare for all. But if you actually want Medicare for all, then you should vote for one of the 2 people who's actually in favor of Medicare for all among the leading candidates. And that's Elizabeth Warren and Bernie Sanders. So you have your choices and they're super clear. Look, when Warren raised her hand and she signed the TYT pledge, she said, get rid of private insurance, and she didn't waffle. So you can say, hey, earlier she made some comments where she said she was in favor of a bunch of different plans. Okay, fair. But now she's crystal clear. And she didn't go and pull the same thing as Kamala Harris. She didn't go run to the reporters going, I didn't mean it, I didn't mean it, right? She raised her hand, knew exactly what she was doing, and has not waffled from it at all. So you have 2 candidates if you want Medicare for all. The rest will not do it. Don't come crying later and go, oh my God, I could have never known. If you watch the Young Turks, you know. On the go, don't worry, we got you covered. You can still listen to TYT at our new podcast network. Find us on Apple Podcasts, the Google Play Store, or at tyt.com/podcast.